Hello, welcome, and thanks for joining us to help choose home when care is needed, a podcast all about the benefits, value, and safety of receiving care and services in the one place that feels most comfortable, wherever it is that the person needing care calls home. I'm your host, Marilee Orsini, and I've been involved in healthcare at home since 1981. Before we meet today's guest, a brief thank you to our sponsors and partners, the National Association for Home Care and Hospice, Access, and CoreCute. Today's episode is number 5 of Season 4. Our guest today is Sara Ratcliffe, Executive Director of the Illinois Home Care and Hospice Council. Sara is also the Forum of State Home Care Association's chair and serves on the board of directors of the National Association for Home Care and Hospice. Please help me, won't you, and welcome Sara Ratcliffe to Help Choose Home. Sara, thank you so much for joining me today. It's such a pleasure to see your face, although our audience is only going to hear you. So thank you. Can you start off by telling us a little bit about the Illinois Home Care and Hospice Council?
Sure. So the Illinois Home Care and Hospice Council is the oldest home care association in the country. And our members are home care agencies and hospice agencies all across the state of Illinois. And it runs the gamut from personal care assistants that come in and provide companion care or assist with activities of daily living, to skilled nursing and physical therapy, occupational therapy, and then also to end-of-life care and hospice. So we kind of run the gamut of all sorts of post-acute care in the home. And we also, Illinois is a very diverse state as far as population and rural versus urban. So we have quite a few agencies that are huge hospital systems, and then we have mom and pop agencies too that I like to call it artisanal home care, kind of the homegrown home care that, yes, and sometimes caters to certain ethnic groups. So we kind of run the gamut. And what we do at the association level, we realize our home care agencies work hard and we try to help make their jobs easier. So whether that's through advocacy on the state and national level to make sure that we're getting the right reimbursement rates or budgets aren't cut, and Medicare, to helping with education so that our nurses and caregivers have the knowledge that they need to provide the quality service that their patients and clients expect.
And does someone who runs an agency that provides care in the home in Illinois, do they have to be a member of the council?
They do not have to be a member of the council. We have probably about 600 home health agencies in Illinois, about 800 home care agencies, which is non-medical home care in Illinois. Our membership represents about 150 agencies, so there's quite a few that are not members of ours. But we have a very solid membership that is not going anywhere. They've been holding steady for several years. And also, we believe, and we've been told this by the Chicago Tribune, that our members are the members that are doing it right, that are up on their game, that know their regulations. And so we're very proud of that fact that our members really are the best of the best in Illinois.
Oh, it sounds like from a consumer perspective, if someone is seeking care at home in Illinois, they should double check that they are a member of the Home Care and Hospice Council.
Absolutely. Just come to our website and we have a Find a Provider button right on the front page. And consumers can click on that and enter in what county that they're in or what kind of service they're looking for. And it'll bring up all of our members in those categories. And so that's a good starting place.
Tell me the URL of your website, please.
It's www.ilhomecare.org.
Hey, that's easy to remember. Well, Sarah, when we last saw each other and spoke, I think was pre-COVID. So a lot has happened in this last year and a half. Can you translate what has happened in this last year and a half about home care and to take us into the future and how that's going to affect people who are seeking care at home in the future?
Sure. Well, that's a lot. I'll do my best. So, it's been a very interesting year, and we were all forced to be home. That was the safest place. And we know, those of us who've been involved in the home care industry know that for our aging population, getting care in the home is the safest place to get care in familiar surrounds that promotes personal independence and dignity. And it's the best and safest place to be. It's where everybody wants to be. So this last year, things got a little tough. So especially in areas where there were COVID outbreaks, we experienced some caregivers were afraid to go in the home, or some patients or clients were afraid to have other people come into the home. So there was that in the early days of the pandemic when we really didn't know what to do. There was the whole thing of having to wear all of this PPE over your face and shields and everything else, which I can imagine psychologically would be tough on consumers of home care to all of a sudden not be able to see people's expressions, or it was kind of a layer that takes away the humanity between caregiver and patient. So that psychologically was tough. But also the social isolation was tough as well. I know it was tough in my own family, us being away from my mom for a while. She has autoimmune diseases, and so we didn't see her, could not embrace her for a long time. So that's really tough as well. So I think what the home care industry did to kind of pivot and make sure that their patients and clients were taken care of is utilizing technology. And so FaceTiming, and thank goodness CMS instituted some waivers that allowed FaceTime as an allowable thing to do in providing care. So caregivers could check in on patients. And I know, gosh, everyone's got a cell phone now that's smart, and even my mom can use FaceTime. So having that interaction that way, it's not as great as a hug or a personal touch, but it did kind of save us. I know we're on Zoom right now. I didn't know how to use Zoom in February of 2020 very well. So using technology helped a lot. In the personal care space, I know for some of our Medicaid waiver participants, being able to use family caregivers as caregivers, that was something that wasn't as allowed before, but really that kind of exploded. And we needed that because we already were facing a shortage of caregivers and nurses. And so it's kind of become almost an all hands on deck situation. We've got the pandemic that happened. We've got an aging population. Those baby boomers are needing more care. And then you've got a shortage of workers is really pushing us to our limits and our creativity and how to get the job done and make sure people are getting the best quality care that they can. So what this will do for the future is, I think it's going to open up. We were talking in Illinois about how do we promote career ladders? How do we get kids interested in caring for the aging population? I used to be a high school teacher, so I know that kids make decisions in high school what they want to do or what path they're going to take for the rest of their lives. And how do we start them on that path in caring for the elderly and the home? So I think there's a lot of things. A lot of the pandemic was was a crazy, awful time. And I think we've all collectively lost a year. I don't remember when things happened over the past year. But I think there's a lot of opportunities that came out of that punctuated equilibrium that we can explore for future viability of care in the home.
Can you expand a little bit on that? Are you talking about using more virtual visits?
Yeah, I think technology, I don't think it's ever going to replace home care. But I think it's a good tool that we can use in between to kind of stretch out our caregivers a little bit more. So, I mean, even doing physical therapy visits over technology. And I saw a demonstration by one of our members where they, had a hookup in the house and they're doing the exercises together with them. And that caregiver doesn't have to travel, 20, 50 miles to get there. So being able to assess via technology in the interim between in-person visits, I think will help a lot. We had other ways that some agencies were supporting their nurses by employing other employees who had been furloughed during the pandemic to drive them around instead of the nurse having to drive. So the nurse could do their chart work and everything in the car in between visits. And that helped a lot with satisfaction of the nurse, gaining some life-work balance. So when they go home, they didn't have to spend more time after their visits. So I think, more and more we're going to have to find creative ways to use our caregivers in a smart way so that we are not burning them out because we need them more than ever. I think technology can help with that. I think training family caregivers to help out more in the home, like really training them how to be a caregiver. And, I just know from personal experience, my best friend is caring for her mother who has Alzheimer's, and she has a PhD and everything. She's done all of the education herself so that she can do it the best way possible. Not everyone makes that effort or has time to make that effort or can quit their job to care for a patient. So how can we equip family members in that role as well to augment our professional staff?
That is a very scary proposition to me, is being personally responsible for caregiving for a family member. So I am assuming that a home care agency in that scenario would be very supportive, even if it is virtually, for the caregiver who's got that responsibility.
Yes, absolutely. And I'm making some predictions here that aren't necessarily realities yet, but we're going to have to be as supportive as possible for our caregiving staff, but also for families. We have to work it all together. It is a tough job. It's physically and mentally taxing. And how can we support folks with the skills that they need and also the respite that they need as well? The mental health component is so important. And I think we've all had a bit of that this last year if we weren't prone to some or issues, just the worry, I think back to the last year, and I'm kind of getting off topic, but going to the grocery store and seeing bare shelves. And as an American, that's not something that we're used to, and wondering, what does this mean for my community and for my kids and for the most vulnerable among us? I'm okay, but what about my neighbor who is alone? So I think it was a wake-up call, like to think more outside, even though we were home, thinking more outside ourselves and how is this affecting our community at large and our elderly population.
Well, it seems to me that our government is being more supportive now in terms of resources to help the industry
Mm-hmm.
able to provide care. So can you talk about some of those changes a little bit and how that is going to affect consumers in the future?
Sure. So with everything that we've talked about, that there's this focus on home and community-based services, and the federal government recognizing that this is a good way to go, and congregate living isn't always the best option. Putting resources behind that is going to be huge, because we need to pay caregivers a living wage. We need to make sure that there's plenty of opportunities for people to become nurses, whether it's educational opportunities. We were talking the other day about, can we do like almost a Peace Corps type thing where nurses can go to school for free so that they can get into nursing, and then afterwards they do a stint in home care or community-based care. Just kind of figuring out how can we use what resources may be coming our way from the federal government to create programs that will build the workforce that we need. And so, we can't do anything without the workforce. This is not a job that can be outsourced. This is a job that's homegrown, that we need, that's so essential. I just can't say enough about it. We need workers. And I'm so pleased that the federal government is recognizing that finally. And I hope that we can get everything that we need, or at least get a lot closer.
Sarah, I'm going to switch a little bit and
Sure.
and ask for you personally, how has your history as being a high school art teacher translated positively into your role heading up the Home Care and Hospice Council for Illinois?
Well, it's not a direct path, obviously, to come from a high school art teacher to heading a home care association. So I like to think that my experience as a teacher has instilled in me a certain degree of patience, and also, especially as an art teacher, looking at problems in a more creative way, a little bit out of the box. So nothing's really, we've always done it this way, we have to do it that way. Why can't we try something new? So I try to apply those things. Artists, and Marilee, you know this because I know you're a great collector of art. Artists are great problem solvers. And so I think when we're looking at big problems or challenges that are facing us, like how to solve workforce, how do we care for this aging population, then we need to think about all sorts of different ways that we haven't thought before. Now, personally, I came to home care because my dad was a consumer of home care and hospice before he passed. And it was so touching to me, the compassion that the caregivers gave my father. It stuck with me and it will be in my heart forever. And so I thought maybe eventually I would volunteer for hospice, and then this job came available. I'm like, yeah, I want to do that. And so I think my years as a teacher and dealing with kids and personalities and helping kids grow has translated to association work, in that I have agencies that are from all different backgrounds, all different personalities, and recognizing sometimes people just want to talk and they want someone to listen. And that's what we do on the association level. We listen and try to help solve problems. And so that's what brought me to where I am today.
What a wonderful transition, and how lucky the Illinois Council is to have you in this leadership.
You're very kind. You're very kind, Marilee.
Sarah, we're coming to the end of our time here. Is there something I did not ask you today that you thought I was going to, or that you would like to offer our consumer audience?
Yeah, I would just like to say to the consumer audience, if you're thinking, you might need some help, or if you have an aging parent that you're thinking, well, maybe we should get some help in the home, there is a home care agency or setting for you. So whether it's a skilled need, you're coming out of the hospital and you need some rehab, or there's a home health agency for you. If you need some help around the house or just someone to be with you or help, getting dressed or whatever, there's a home care agency for you. A loved one is looking at end of life scenarios, there's a home care or hospice agency for you. Home care agencies they're very creative agencies. They can help in any way at home. That's where people want to be. It's where everyone is comfortable. They have their loved ones around them. And so I would say to the consumer audience, home care is a good place. Just go to your state association, and I'm sure they all have a find a provider button, and find which setting's best for you.
That is great. Well, thank you so much. And I can't tell you how much I appreciate not only hearing you today, but also actually seeing you. So I look forward to getting together in the future.
Okay. Well, thank you, Marilee. It was a pleasure seeing you and being with you as well.
Thank you. Thank you so much for listening today. And a special thanks to our sponsors and partners, National Association for Home Care and Hospice, Access, and CoreQ. If you have not done so already, please subscribe to our podcast and take the time to leave a review on Apple Podcast. We are now also on Spotify and most other places where you find podcasts. Like and follow us on social media and join us, won't you, to spread the word and help choose home when care is needed.